Hi everybody, this is a video about heavy metals. Someone posted a question on one of my other videos and I'll just read it out here. So it was a test or a video that was entitled Hair Heavy Metal Testing Accurate or Not? So the question basically says if there's lead in the hair in substantial amount, the question is how did it get there? So that's a good question because in the video, please feel free to watch the whole thing if you're so inclined, but the punchline is that I don't think that hair heavy metal testing is the most useful way of assessing whether somebody has an elevated heavy metal burden. The best test, in my opinion, is a provoked urine heavy metal test. So, but indeed, with these results, and I've seen a number of hair mineral analysis results or hair toxic metal results, depending on the name varies depending on what lab's running it. But yeah, sometimes we'll see really, really high levels of lead in the hair and sometimes other heavy metals. And so what's the significance of that? My understanding of it is that the hair is indeed an organ or a method rather of secretion of different toxic substances. So the lead in this case, to my understanding, is getting there because the body is flushing it out through the hair follicles, I suppose, and that's binding onto the hair and it's getting out into the world that way. So I don't think that there's any question or debate around whether there's actually metal that's in the hair and where it's coming from would be coming from inside the body. I mean, unless somebody's washing their hair with lead-based paint or something crazy like that, it's coming from inside the body and getting excreted. It's just a question of, is that actually useful for testing purposes? And as I mentioned in the other video, there's really I think some debate around that because it, to my understanding, has not been a formally validated way of testing. So it's coming from inside the body, and it's just that's where it's coming from. The other question was, is the other part of this second question that was included here was, is there another way of provoking other than DMSA? Person asking is from Australia, and there's limitations there in terms of what they can access by the sounds of it. There's limitations on certain things in lots of different places. We have limitations here in Canada as well. But there are other ways of provoking than with DMSA. As per usual, this is for informational purposes only. This is not medical advice. Please talk to your doctor if you need medical advice. DMSA is an oral chelator that can be it's a good oral chelator. In my opinion, it's not the best way to test because when we take something orally, in many cases, we don't know exactly how much of that's going to get absorbed into our bloodstream, therefore how much is going to get into our cells or the area surrounding our cells. And so we don't know if we're getting a full dose delivered to our tissues or not. Intravenous chelators are 100% absorbed because they go right into the bloodstream. So to answer the question as technically as possible, yes, there are other chelators, DMPS and EDTA, but those really, to be effective, have to be administered intravenously. In terms of other chelators that one could access that are not administered intravenously, I mean, there are other metal chelators out there, but for general, heavy metal provocation testing, I'm not aware of any other chelators that are nearly as good as DMSA in terms of oral options. So the best, in my opinion, are the IV options, DMPS and EDTA, but oral DMSA would definitely be second best. And it is a good way of testing. When I do have patients that are not able to access the IV chelation needed for the optimal way to test for heavy metals, then I certainly do use oral DMSA. I use maybe a modified kind of protocol. I have my patients take a certain dose of DMSA for a few days in a row and then collect a urine sample after the third day's dose, just to really get the metals kind of mobilized in the system, because I feel like, well, we really want to get things mobilized, and if only a third of the DMSA is absorbed, for example, for a given patient, well, then I want additional dosages there just to err on the side of caution. So that's kind of the way that I bridge the gap between the reliability of intravenous chelation for testing purposes and then using oral DMSA instead if that's the only option. For treatment, in my opinion, DMSA and IV chelators can work equally well in the grand scheme of things, but the IV chelators do seem to get rid of the metals faster. That was the end of the questions. Thank you so much to the person who posted the questions. They're good questions. Always happy to talk about heavy metals. If anyone else has questions about this topic or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.